So we're going to continue talking about vital signs now. So vital signs are a very quick way for the medical staff to determine how well or how ill a patient is. So if a patient comes in and their temperature is really low. Say they were found down on the floor, they've been on the floor, they were found out in the woods, and they can have a very low body temperature. So a temperature is a key measurement as to how well or how sick the patient is doing. Confused elderly patients, alcoholic patients, anyone who's found down can certainly have a problem with their overall body temperature. The cold patient with a temperature 86 degrees instead of 98.6 is at high risk. They need to be dried off and warmed up slowly. We need to give them warm fluids, warm IV fluids, keep them in a warm towel, blankets that are in warmers. If the patient is very cold, like in the 86, 82 degrees, um, they need to be put on a warming blanket and they need to have a rectal probe inserted so that their temperature can be very closely monitored. And what you want is an internal monitoring so we know exactly what their core is doing. This can certainly become a medical emergency and the patient may need to have CPR. It is critical that they are not warmed up too quickly, but rather warmed consistently and monitored very closely. On the other side of that is patients that come in with really, really high temperatures and again, a medical emergency. And it's an opposite of medical emergency because now we need to work to cool off the patient. We can use a cooling blanket, which is a blanket that actually has cold water running through it to cool them off. We want to give them lukewarm fluids. We want to give them ice if appropriate. We want to remove all their clothing so that the cooling blanket is right on them. Want to, you know, um, give them a bath with tepid water so that, again, we can start to cool them off. We don't want to cool them off too quickly, but we need to get them cooled off so that they don't become what the danger is if they stay warm too long, their brain can begin to swell. So you have to start getting them cooled off rapidly, being the interactions, but not take their body temperature from 106 down to 98 quickly. You want to do that gradually, but you want to um, consistently do that. You can also do such things as put ice packs under their armpits, behind their neck, and in their groin area to cool off the core. These are great interventions, and the nursing staff will certainly guide you or the physician on what they want to have done. So for another vital sign that they sometimes call a vital sign and sometimes they don't, it just kind of depends on where you went to school, is the pulse oximeter. So pulse oximeter is a little device that we'll use in class, and it will give you the heart rate and will also give you the amount of oxygen saturation in the blood. Before using an oxygen sat monitor, you do need to remove nail polish, and because the nail polish, what happens is the oxygen saturation is actually done by the light in the sat monitor looking through the nail bed. And so if you have acrylic nails or lots of nail polish on, it can't see through there. Some diseases of emphysema and asthma actually are really tough to get a pulse ox reading. Also, if a patient's fingers are really, really cold or they have bad peripheral vascular disease, sometimes you can't get a good oxygen saturation. In that case, you can try the earlobe because there's special sat monitors that actually will tape onto the earlobe. So a normal oxygen saturation is between 95 and 100. Someone who's ever smoked in their life is probably never going to be 100%, um, but normal is 95 to 100. There are patients who saturations can be in the 80s, and these are patients with chronic lung disease. Any oxygen saturation that is below 70% is considered life-threatening. So if ever you were to put on an oxygen saturation monitor and get a reading of, 72, 74%, you would want to change fingers and check it. And if you get that again, you would want to report those findings to the nurse immediately. So orthostatic vital signs. When are orthostatic vital signs used? Orthostatic vital signs are used for anyone who's had syncope. That means they fainted. If you lose consciousness, you want to do orthostatic vital signs. If they're dizzy, you want to do them. So you can just go ahead and do those on initial assessment. If you know that the patient's fainted, if you know the patient's complaining of dizziness, I would just go ahead and do them right off the board because you're going to need to do them. So what's happening is if the patient is orthostatic, they're having decreased blood to the brain, and it's caused by either volume depletion or dehydration. So, which is dehydration, volume depletion. And also it can be caused by sometimes patients just are on too many cardiac medications to lower their blood pressures, and that can also be a cause. So the orthostatic vital signs are a three-step process. The first thing you want to do is lay the patient down and have them lay down flat, or as flat as possible. If they're a lung disease patient and they can't lay flat because they're, you want to lay them as flat as possible. And then you want to leave them in that position for a few minutes and then take their blood pressure and their pulse. Then you're going to sit them up real quick and take their blood pressure and pulse again and see what it does. And then you again, now you're going to stand them up and you're going to take their blood pressure now standing and pulse standing. And you compare them. So a blood pressure should not go down when you go from laying to sitting or sitting to standing. And if it does, no wonder the patient's feeling dizzy when they get up because it's going to be, they're not getting enough blood flow to their head. So a drop in blood flow of 20 millimeters in mercury or a rise in the pulse rate of 20 beats per minute is considered to be positive finding and that the patient is considered to be orthostatic. So you would want to report those findings right away to the nursing staff. Now, if you are doing orthostatics on a very large person and you're concerned because they just passed out in the field, certainly get someone to stand by. You don't want to take this patient and sit them up and then have them dangle on the side of the bed and take their vital signs and then stand them up and have them fall on you. So make sure you get help if you think that there's a possibility the patient's going to pass out again. So those are very valuable findings for the physician because it can determine whether or not we're going to give the patient a lot of IV fluids or not. And little ladies get dehydrated really easy because they all will tell you that they drank, oh, I drank 2 quarts of water today. Well, they drank 2 quarts of water over the last 2 weeks, and that's it. And, they don't drink a lot of water because they're worried that they're going to find that they're going to have an accident.